Here's a number that surprises most men. By the time they reach 60, more than half of men have some degree of prostate enlargement, and by their 80s, it's roughly 9 out of 10. 9 out of 10. So if your prostate is causing you a few new inconveniences, you are not the exception. You are, statistically, the rule. And that matters, because a lot of men treat every single prostate symptom as a 5-alarm fire. They notice one change and their mind jumps straight to the worst possible place. But the truth is that most of what an aging prostate does is common, harmless, and manageable, while a smaller, specific set of symptoms genuinely does deserve a prompt call to the doctor. So here's what I've put together for you. A clean, simple checklist. 5 symptoms that are usually just normal aging, and 5 that mean you should pick up the phone. By the end, you'll be able to sort your own experience into the right box instead of lying awake guessing. A caveat before the list. A checklist can point you in a direction, but it can't examine you, and your own doctor is the only one who can say what's really going on. Use this to know when to make the call, not to make the diagnosis yourself. These are the symptoms that come from the common, benign enlargement of the prostate, the kind most men develop with age. They're worth mentioning to your doctor, especially if they bother you, but on their own they are usually not a danger. Here they are. Number 1. A weaker or slower urine stream. If your stream isn't the forceful thing it was at 30, that's by far the most common change of all. It's the enlarged gland gently narrowing the tube the urine flows through, extremely common and on its own not alarming. Number 2. Getting up once or twice at night to urinate. A trip or two overnight is a very ordinary part of an aging prostate and an aging bladder. It becomes worth a closer look if it's many times a night and wrecking your sleep, but once or twice is squarely in normal territory. Number 3. Needing to go more often during the day or feeling the urge more suddenly. A prostate pressing on things makes the bladder more sensitive, so it signals full sooner. Annoying, yes. Dangerous, usually not. Number 4. A little hesitancy, taking a few seconds to get started. When the tube is slightly narrowed, it can take a moment to get going. Common and by itself benign. Number 5. A feeling that you haven't completely emptied or a bit of dribbling at the end. Again, the mechanics of a narrowed passage. It's a nuisance far more often than it's a warning. Notice the theme across all 5. They're the everyday plumbing symptoms of a gland that's grown a little and is pressing on the tube running through it. Common, manageable, and, this is important, often very treatable if they bother you. Normal doesn't mean you have to just suffer through them. It means they're not an emergency, and there are good options if you want relief. Now, I don't ever want to give you the impression that every urinary symptom is automatically fine. That would be its own kind of dishonesty. So, here's the other list. 5 symptoms that are not the ordinary plumbing kind, and that deserve a prompt conversation with your doctor. Not to frighten you, but because knowing this list precisely is what lets you relax about the first one. Number 1. Blood in your urine or in your semen. This isn't a typical symptom of ordinary enlargement, and while it often turns out to be something manageable, it always deserves to be checked. Don't sit on this one. Number 2. Pain or burning when you urinate, or pain when you ejaculate. Ordinary enlargement isn't usually painful. Pain or burning can point to an infection or inflammation that needs treatment, so it's worth a call. Number 3. Suddenly being unable to urinate at all, even though you badly need to. This one isn't a make an appointment next week symptom, it's an urgent one. If you genuinely cannot pass urine, that needs prompt medical attention, often the same day. Number 4. Fever or chills alongside urinary symptoms. Fever isn't part of ordinary prostate enlargement. Combined with urinary trouble, it can signal an infection that needs proper treatment, so don't tough it out at home. Number 5. New bone pain, especially in your lower back, hips, or thighs, or unexplained weight loss along with urinary changes. These are the more serious flags, the ones worth taking seriously and checking without delay. They're much less common than everything else on today's lists, but they're exactly the ones you don't want to ignore. There's your 5. Blood, pain or burning, total inability to go, fever, and new bone pain or unexplained weight loss. If any of those show up, that's your signal to stop guessing and get seen. Let me add the one piece of nuance that makes this whole checklist actually useful, because it's easy to misread. Normal does not mean ignore it forever. It means this is common and not an emergency. Even the reassuring 5 are worth mentioning to your doctor at your regular visits, partly because if they bother you, they can often be treated and you'll feel better, and partly because your doctor tracking them over time is how the occasional exception gets caught early. And the second thing, this checklist sorts symptoms by urgency, not by diagnosis. It tells you when to worry and when to relax. It doesn't replace an actual examination. Think of it as knowing when to make the call, not as making the diagnosis yourself. Let me get personal with the man who came here quietly anxious, because I suspect that's a lot of you. If everything you've been noticing lives on that first list, the slower stream, the once or twice at night, the occasional urgency, then take a real breath tonight. What you're experiencing is what the large majority of men your age experience. It's usually benign, and if it's bothering you, there's genuinely effective help available. You don't have to carry a low-grade fear about it. And now you also know the exact 5 signs that would tell you it's time to act, which means you can stop scanning every twinge for disaster and just live, keeping half an eye on the list. That's peace of mind you can actually use. So here's where this leaves you, going forward. You now have a simple mental filter that most men never get handed. When a new symptom shows up, you can ask yourself, is this the ordinary plumbing kind, or is it one of the 5 to watch? Most of the time, it'll be the ordinary kind, and you'll be able to set the worry down. And on the rare occasion it's one of the 5, you'll know immediately to make the call, early, calmly, and without panic. That filter will serve you for the rest of your life. Keep it handy, and you'll navigate this part of aging with a lot more confidence and a lot less fear than the man who never learned the difference. Think of it as a guide for when to act. The diagnosis itself belongs to your doctor. I'm genuinely curious in the comments, which list did most of your symptoms land on? My guess is the normal one for most of you. If this gives you a calmer way to think about your own body, it helps push it in front of the next guy instead of the fear-mongering that usually fills these searches. And if you want to understand why those everyday symptoms happen in the first place, the video on the simple anatomy behind it is a good next watch.